You're listening to the Quint's podcast.
Amid a surge of new COVID-19 infections across the country, Maharashtra is in the headlines again, a state that faced the brunt of COVID-19 cases in 2020 and on 17 March 2021 reported 23,179 new cases, a 30% rise in just a day. And one city is holding the torch for being the national COVID hotspot again, Pune, where every third case in the state has been recorded. It is also the home of the Serum Institute of India, the manufacturer for Covishield, one of the two vaccines approved for emergency use in India. Pune district reported 2,612 new COVID cases on 17 March and has also reported a 10x rise in daily cases when compared to case figures of 31st January 2021. While case fatalities are not high when compared to past figures and surges, the larger question is what is triggering this sudden surge of cases in the city. Is it due to the reluctance of Puneites to follow COVID-19 appropriate behavior, or are we actually seeing the new COVID variants in action? So in today's episode, to understand the ground reality and what Pune is going through, I spoke with Dr. Varsha Dange, who is a nodal medical officer for the Pimpri-Chinchwad Municipal Corporation, or PCMC, a district which has witnessed more than 10 times rise in cases since 31st January. You're tuned in to The Big Story, the podcast where we dissect the headline-making news for you, and I'm your host, Himmat. In a press conference on 17 March, the Health Ministry stated that nearly 62% of the country's active cases and 45.4% of the fresh deaths are concentrated in Maharashtra. Nagpur city reported the highest number of COVID cases during the day, which was 2,698, followed by 2,612 in Pune and 2,377 in Mumbai. Maharashtra reported 84 deaths in the last 24 hours. While the city of Nagpur has gone into lockdown starting 15 March, Pune is still fighting COVID head-on, with the night curfews in place and restaurants and theatres restricted to 50% capacity only. In the last week of January 2021, when the weekly positivity rate of Maharashtra was 4.65%, Pune's positivity rate was 7.40%. And in the current week of March 2021, when the state's positivity rate is 14.66%, Pune's positivity rate is close to 20%. And PCMC is one of those areas that is currently witnessing positivity rates of 18 to 20%. So what is triggering this sudden rise in cases in that area? Dr. Varsha Dange, who is the nodal officer for COVID-19 at PCMC, stated that the biggest factor contributing to the recent rise in cases is the complacency of people to follow COVID-19 appropriate behavior.
There are multiple reasons actually, but then the most important reason is complacency amongst people. Last year around this time of the year, we used to get these many cases, whichever we are acquiring right now or we are getting right now. But then there is a difference then and now is then there was complete lockdown and now everything is open. So on that background, we are supposed to or we are bound to get a little bit more cases. The contributors for these more cases might be a new variant, or it is moving from one areas to the periphery, or maybe a rural component has added more, or we are getting more cases in the rural areas also, or the different districts from Maharashtra, they are getting involved. And but of course, the second thing is a complacency from people about COVID appropriate behavior. So initially in the month of January and February, we had only 100 odd cases per day. Now we have reached to 1,200 cases a day. Like the positivity rate was say in between January and February, it was around 5 to 10%, but now it has increased in around 18 to 20%. And the death rate, if you are talking about, we are actually having the least death rate. So it is 1.8%. So it is in and around 1.8% to 1.9%.
Now, in our previous episodes, we have discussed in detail the nature of the new domestic variants of COVID-19, with it being more contagious and more spread out within households. You can find links for that episode in our show notes below. Dr. Dange stated that PCMC is witnessing the same trend. However, this is actually helping the corporation in catching cases faster and isolating families when required.
We are able to pick them at the earliest. once we are doing the contact tracing and we know that these people they are getting infected, so we can pick up those people in and around the family in a better manner through contact tracing and through contacting them and getting them tested, so that we can actually curtail down the spread.
Okay, so but what kind of demographic are you witnessing in PCMC in terms of recent cases only?
Is the age group in between, say maybe 30s to 50 or 60. That age group is getting affected more. So like
Okay.
very geriatric people, maybe they are not moving out of the house. That's why they are not getting affected. And children, they were like very mild or minute amount of children they were affected. But now children are also getting affected.
Oh, okay. And how severe is the infection in these cases? Is it more symptomatic? Or
Uh,
I think in
in
cases?
the younger age group, actually, in the younger age group, there are less symptoms. We can see them, or we could discharge them at the earliest, and they are not getting symptoms. Maybe just a simple fever for 2 3 days and sore throat and something like that. So like once the affection is in the age group, say maybe above 50 years or 60 years of age group, then they are catching the pneumonias very fast.
However, according to medical experts and virologists, more evidence is required to state with certainty that the surge in Maharashtra, especially in hotspots like Pune and Nagpur, can be attributed to new variants. And a rising surge in cases is not the only problem Pune is facing. The city also recently witnessed a confusing scenario where the Pune Municipal Corporation found itself with only 50,000 doses of Covaxin instead of the 1 lakh doses of Covishield, which majority of the frontline and healthcare workers have taken inoculations for. And the situation becomes ironic because Pune is home to Serum Institute of India, the world's largest vaccine manufacturer, and the Indian manufacturer for AstraZeneca's vaccine Covishield. Maharashtra Health Minister Rajesh Tope on 16 March spoke with his union counterpart Dr. Harshvardhan to seek 20 lakh doses of Covishield and Covaxin every week to vaccinate the residents of the state. According to Dr. Dange, the PCMC area currently only has enough vaccines to accommodate inoculations this week.
Actually, we are getting the vaccine. Right now, there is enough vaccine in Pimpri-Chinchwad municipal area to vaccinate according to the current rate at which we are vaccinating. So, like we have enough doses of Covishield to vaccinate furthermore for a week or so. Meanwhile, the state has assured us that they will supply the vaccine. Right now, the government strategy is seeing the vaccine consumption first. So what they're doing, they're seeing how much is consumed in last 10 days, and that further 10 days supplies they are supplying. So
Okay.
like if we are consuming whatever consumption is there in last 10 days, that average is being taken and we are getting supply in that amount.
As an education hub and an industrial hinterland, Pune is among the most preferred migration destinations for job seekers from various states. With almost 70% of its population living in urban areas, the big question in front of the city is if a lockdown is a solution to curb the rising cases. According to Dr. Dange, the only way to curb the cases is for people to be diligent in following COVID-19 appropriate behavior, which means wearing masks when in public, social distancing, and not attending large-scale public events.
We already had a lockdown, and that has affected our economy also. Like the poor section has grown much poorer, and other people they are barely surviving. So like it has its own effect on economy. And right now everything is open. If we are taking good precautions, if we are following the COVID appropriate behavior, and then if we are asking our extremes of age, say maybe less than 10 years and above 60 years not to come out in the community very often unless and until it is indicated, then I guess so lockdown won't be required.
Now, it is important to state that Pune actually did witness a slowdown in cases. The positivity rate was less than 5% in the months of January and February, and the doubling rate of infections across the city had also increased, with Dhole Patil Road, which was once one of the worst affected areas in the city, estimated to take 1,324 days for cases to double. What remains to be seen is if Pune has learned lessons from its efforts to curb the virus in the past, and if they will be translated to action. And I, as a resident of the city, can't wait to see it back in action. If you want to know more about COVID-19 vaccines and treatment, head over to the Quint Fit and the Quint websites. You can also catch all updates regarding COVID-19 on all our social media platforms. If you liked listening to this episode, please subscribe to The Big Story for episodic updates. We're available on Apple, Google Podcasts, Spotify, JioSaavn, and most of the other popular podcast streaming platforms. For other podcasts, please log on to the Quint website, and for any feedback, please shoot an email to podcast@thequint.com.
Thanks for listening. Log on to the Quint's website and check out our other podcasts.